So, avascular necrosis of the hip, it describes a segment of dead trabecular bone and marrow involving the femoral head and extending to the subchondral plate. So, avascular necrosis, it is a segment of dead trabecular bone and marrow involving the femoral head and extending to the subchondral plate. It is also called osteonecrosis or ischemic necrosis. What is the mechanism? When interruption of arterial inflow occurs, this interruption of arterial inflow may be due to traumatic cause or compressive cause, or if the venous return is impaired, then AVN can occur. Example of impaired venous drainage is, for example, increased marrow pressure or intraluminal vascular obstruction. In case of elderly patient, the commonest cause of AVN is subcapital femoral neck fracture. In younger patients, this is the cause is usually non-traumatic, and commonly in younger patient, AVN is bilateral. What are the causes of AVN is steroid, radiation, sickle cell anemia. In case of sickle cell anemia, trapping of abnormal RBC occurs. Alcohol abuse, pancreatitis is also a cause of AVN. Here, fat embolization occurs that causes AVN. Gaucher's disease. In Gaucher's disease, marrow infiltration and subsequent vascular compromise occurs. Caisson disease, rapid decompression after breathing pressurized air causes microbubbles of nitrogen to precipitate out and occlude small vessels. MRI is more sensitive than CT or scintigraphy in the early detection of AVN. Stage 0, asymptomatic. On X-ray, stage 0 is normal. MRI may be non-specific bone marrow edema within femoral head. Fat suppressed T2 weighted or stir is needed for optimal sensitivity. Stage 1, here clinical symptoms present. On X-ray, there are normal trabeculae. There is minor osteoporosis in stage 1. On stage 2, there is more diffuse osteoporosis with osteosclerosis. An infarct is distinguished from normal bone by a shell of reactive bone. On X-ray, stage 2, findings of stage 2 lag behind the pathology, weeks to months. On MRI, a double line sign that is present 80% cases. It is a serpiginous low signal intensity line. So it is a serpiginous low signal intensity line on T1 and T2 weighted imaging with an adjacent rim of high signal T2 weighted high signal on T2 weighted imaging that represent edema. So what is double line sign? Double line sign is a serpiginous low signal intensity line with an adjacent rim of T2 high signal intensity edema. This describes a low signal sclerotic line next to a high signal hypervascular line demarcating the extent of the lesion. Stage 3, here the femoral head loses its spherical shape. On MRI, crescent is present. What is a crescent? Crescent is a low signal intensity line on all sequences paralleling the subarticular cortex. So, what is a crescent? Crescent is a low signal intensity line paralleling the subarticular cortex and representing a subchondral fracture. This precedes overt collapse. So, crescent sign, it precedes overt collapse of the femoral head and the joint space remains normal. On stage 4, further collapse with cartilage destruction, joint space reduction, and secondary osteoarthritis. On scintigraphy, this detects AVN earlier than X-ray. So, scintigraphy can detect AVN earlier than X-ray. There is initially a photopenic region followed by increased activity. These represent revascularization, repair, and secondary osteoarthritis. Lecca-Perthes disease, spontaneous AVN occurring without a known insult in children is known as Lecca-Perthes disease. Spontaneous AVN occurring without a known insult in children. It commonly occurs between 4 and 9 years. Patients present with a painful limb. It can mimic an irritable hip or infective arthritis. It is usually unilateral but bilateral in 15% cases. It can occasionally be bilateral and synchronous but is more usually metachronous and therefore asymmetrical. Synchronous disease should raise the possibility of an epiphyseal dysplasia. There are 4 stages of disease: devascularization, collapse and fragmentation, reossification, and remodeling. So, devascularization, collapse and fragmentation, devascularization, collapse and fragmentation, devascularization, collapse and fragmentation, devascularization, collapse and fragmentation, reossification, remodeling. On X-ray, a loss of height, fragmentation, sclerosis of the femoral head with disease progression. There can be a coxa magna deformity with lateral uncovering of the capital femoral epiphysis, with or without irregularity of epiphysis. Crescent sign can be present on X-ray. It is a radiolucent subchondral fissure. On ultrasound, a hip effusion lasting more than 6 weeks is associated with development of Lecca-Perthes disease, with or without capital femoral epiphyseal fragmentation and poor coverage of the femoral head. On MRI, signal abnormalities may be detected less than 3 months following the disease onset. On T1 weighted imaging, typically low signal intensity. On T2 or star fat suppressed images, high signal intensity. On contrast, identifies any viable bone. Complete loss of signal intensity represents dead bone. Other examples of AVN and the affected region: Kienbock disease occurs if the AVN occurs in lunate, then it is called Kienbock. In case of navicular Kohler's disease, second to third metatarsal head, Freiberg's disease, spine, Camel's disease, post-traumatic proximal scaphoid pole and talar dome. It occurs post-traumatic cases. Transient osteoporosis of the hip. So this is a self-limiting painful condition of the uncertain etiology, may go on to involve other parts of the skeleton. Regional migratory osteoporosis. On MRI, extensive bone marrow edema involving femoral head with or without neck.